6:15, April 25, 2024. And I now call this Health, Education, and Welfare Committee meeting to order. To introduce the members of the committee, we have to my far left Senator Frank Cruz, Senator Dennis Mendiola. I am the chair for this committee, Donald Manglonia, and joining us online is Senator Selena Babauta. Senator Karina Magofnia is absent today and is excused, and we have the quorum to proceed with today's committee meeting. Assisting the committee, we have our counsel sitting in for Counsel Villa-Gomez. We have Counsel Bermudez, our LA, Devin Macarana, Sergeant at Arms, Ben Terlahi, and our IT manager, Jonathan Diaz. All right, with that, before we adopt today's agenda, I'd like to make clarification that item 5D, just to make that technical amendment, it should be Senate Bill 2352. All right, with that, can I get a motion for the adoption of today's agenda? All right, a motion was made and seconded. All in favor, say aye. All opposed, say nay. Motion carries. We now move on to public comments, and the floor is now open.
Good morning, Chair and members of the committee. My name is Joseph Kevin Villa-Gomez, the Administrator for the Addiction Services Unit at the Community Guidance Center, Commonwealth Healthcare Corporation. The Healthcare Corporation has submitted comments on House Bill 2323, and I'm here just to add our support for this from the Community Guidance Center. This is the bill to create overdose policy in the CNMI. And in particularly, we're focusing on allowing frontline workers, which includes first responders, healthcare professionals, and law enforcement officers, to be able to administer a life-saving reversing drug for opioid addiction called Narcan. One of the significant challenges these frontline workers dealing with opioid addiction is that it's becoming a huge public health crisis in the United States, and we are gearing ourselves up so that in the event, we're hoping it never does, but in the event it gets to our shores, we will have a chance in addressing it. Just to give a quick background, fentanyl death or overdose, for example, which is a type of opioid, fentanyl overdose in the United States averages of over 100,000 for the past 3 years, where every year over 100,000 individuals die from overdose of fentanyl. Fortunately, the same crisis is not yet here in the CNMI, but we need to be ready to address it should it get here. Narcan, which is also known as naloxone, is a life-saving medication that can reverse the effects of opioid overdose like fentanyl and prevent fatalities. Therefore, it is imperative that the frontline workers have the ability to administer Narcan to individuals who are experiencing an overdose. Frontline workers are often the first one on the scene of an emergency, and having the ability to administer Narcan can mean the difference between life and death for the individual experiencing an overdose. And by empowering frontline workers to administer Narcan, we can ensure that life-saving treatment is delivered swiftly and effectively, increasing the chances of survival for those in crisis. Narcan is safe and effective medication that can be administered quickly and easily, even by individuals without extensive medical training. The medication works by binding opioid receptors in the brain and blocking the effect of opioid, effectively reversing the overdose and restoring normal breathing. With proper training and education, which House Bill 2323 addresses, frontline workers can confidently and competently administer Narcan in emergency situations, providing immediate relief and support in distress. In conclusion, Chair and Committee, frontline workers are on the front line of public health emergencies, including opioid overdoses, and should be empowered to administer Narcan to individual in need. It is essential that we recognize the critical role that frontline workers play in addressing the opioid crisis and support their efforts to prevent overdose fatalities and promote harm reduction strategies. Empowering frontline workers to administer Narcan is a vital step towards creating a safer and healthier society for all. Thank you.
Thank you, Mr. Villagomez.
Hello. Day, Honorable Chair and members of the committee. Thank you for having us today. My name is Guadalupe Atto. I'm the Executive Director of Saipan Humane Society, and I'm here on behalf of my team and staff to express our support for House Bill 2334, enhancing access to humane euthanasia. Saipan Humane Society, our mission revolves around advocating for the health and well-being of animals and providing assistance to those who cherish their pets. We also work with very closely with the DCP organization or DCP program to work with the strays that are brought into the shelter. Accessible euthanasia stands as a crucial pillar in animal welfare. In our underserved areas, countless animals endure unnecessary suffering without a straightforward means to end their suffering humanely. This affects animals who are suffering on our streets, pets at the end of their lives, and people who love their pets. I've witnessed firsthand the toll euthanasia takes on staff. Without access to controlled medications, the process becomes complicated and poses risks to the safety of those performing it. The emotional strain of euthanizing animals using other methods cannot be overstated and must not be disregarded. It is imperative that our animal control and welfare agencies have access to controlled medications for euthanasia. Doing so not only promotes animal welfare, but also preserves the bond between animals and humans. Additionally, it ensures the safest and most efficient means of euthanizing animals, thus safeguarding the well-being of those tasked with performing these challenging duties. Thank you for your attention to this matter, and I urge you to support House Bill 2334 for the betterment of animal welfare in our community. Thank you.
Thank you, Ms. Atto.
Good morning, dear Honorable Chair and members of the committee. My name is Lauren Cabrera. I am the Animal Health Officer for Department of Land and Natural Resources, the President of Saipan Humane Society, and the President of Guam Animals in Need. I'm here today to also express on behalf of DLNR our support for House Bill 2334 to increase access to humane euthanasia for animal control agencies and humane societies. As an animal lover, it pains me to see animals suffering on our islands. Unfortunately, due to limited access to veterinary care and spay-neuter surgery, the feral dog and cat population grows and suffering is inevitable. This population growth has been well documented as posing significant threats and concerns to public health, environmental health, the livestock industry, and especially the tourism industry. As we struggle to control the population of free-roaming dogs through sustainable spay-neuter efforts, there also needs to be a means of easily and humanely euthanizing animals who suffer or pose a threat to our community. In the past, we have struggled for access to humane euthanasia and were forced to resort to undesirable methods. Over the last year, I personally assisted in euthanizing over 1,000 animals for the Saipan Dog Control Program using humane but challenging methods. This practice all depends on my personal involvement. My goal is to create a euthanasia program that is sustainable beyond just me as an individual being involved. This bill is modeled after the euthanasia bill on Guam and in many other states in the country. It would allow the Animal Control Agency or Humane Society to hold a controlled drug or DEA license specifically for procuring certain controlled drugs for euthanasia. Those who handle the controlled drugs would undergo formal euthanasia training process, which I will help facilitate. This training would include education regarding the federal regulations which must be abided by in order to safeguard these medications. In many states and Guam, this model of euthanasia has been very successful. In the CNMI, without access to a veterinarian living here, it is even more critical. Thank you for considering my perspective on this matter. I'm happy to answer any questions you might have.
Thank you, Ms. Cabrera.
Good morning, Chair. My name is Vicente Camacho Borja, and I'm the owner of, I'm president of Tanoan Medical Transport. It's a new company that we opened on 2022. I am here to support the 23-52. Since the day that I operate or open the business, I have not legally operate and transport bedridden patients. And one of the main reason is we need our ambulance to be certified. In Guam, I've been doing this for the past 25 years in Guam, helping numerous couple companies successfully. And in Guam, Department of Public Health, you just call Department of Public Health EMS program are the one that certifying private and Guam Fire Department ambulance company. What it is they go in and they check all the durable medical equipment. So durable medical equipment is equipment that are maintained like gurney, AEDs, suctions of 3 different kinds, BP cuffs, stair chair, spine board, the straps, basically all the standard ALS, which is that van life support equipment inside the ambulance. All of this equipment must be in place. It's designed for emergency purposes. However, basic life support utilize only the gurney and the GASA and the BP, but we are required to have all of this emergency as far as even OBGYN kid, BP cuffs for infant, toddler, adults, and large people. We have to have cervical collar from infant, and all of these durable medical equipment needs to be in place. One of the main things that we are, the biggest problem is the certification part, where I have a biller, my financial, my consultant biller, and in order for us to avail Medicare services, and it's also be compliant with Medicaid, is Medicare requires that ambulance must be certified. What it is the state agency will issue a certification. We attach that with our application for approval. If we don't have that certification, we are actually in a big liability, because they can always come back and audit us, and that will be a big issue on our in our company. Let's not forget 2012, what happened to St. Michael's, and that's exactly what happened. However, CNMI are not licensed, they're not licensed to do that. They don't have licensure, but to be safe and to make sure that we're running efficient, we make sure that we have all the equipment, the durable medical equipment, durable medical supplies in the ambulance that will keep, we'll make sure that if anything happens to our patient, that we are equipped, our EMT is equipped with all of those DMEs and DMS to, transfer this patient safely to the hospital. So I'm here to support this 23-52. I hope that you help me. This will really also generate revenue, and we'll be able to avail Medicare, benefits for our CNMI patients. we all about 90. I didn't really do a really statistic on this, but I'm finding out that a lot and most of our recipients and most of our Sinamite citizens have Medicare. So we need to avail that, and I believe that's a benefit for them to utilize, so Medicare can pay for the services. That's all, and thank you very much.
Thank you, Mr. Borja. Can you just stick around after we're done with the public comment just to answer a few questions if you're available?
Sure.
Thank you.
Thank you very much.
Good morning, Chairman Donovan Glonia and Senator Frank Cruz, Honorable Senators, Senator Frank Cruz and Senator Mendiola, and I believe some senators are online. So I just want to say good morning to the staff attorneys and the staff, and thank you for allowing me again to testify on this committee hearing. First of all, I want to discuss three bills here that I want to talk about briefly. But specifically, I'm here to support Senate Bill 2353. I understand the good Senator Magofnia's off. She's the author. But we'll come back again and participate on hopefully soon, when Senator Magofnia will come in. And as you can see, Mr. Borja said that, the state, this bill, the Amendment 2352, is really the state putting the liability away from, the liability has to, now it's on the companies, and it's very important that the state has to step in and have a centralized certified and public law in January 25th, 2015, when the public law 18 does, I believe 18 does 73, that transferred the fire emergency from DPS to the new department. There's 5 division, and there's 5 division in there, and one of their goal is to take the overall safety of the public, have confidence that the state, which is the Sinamay as an entity, government, would be the one to handle all these medical emergencies. This Senate bill, this amendment from Senate Bill 2352 is to amend the public law 18-73 and to add additional responsibilities to the state as Sinamay as an entity, so they can certify. There's 2 things there, briefly. The vehicle, the non-emergency medical transport, is the certification of the make sure that the driver, the brakes, and everything's certified, the aircon. But the main thing is the one inside, the non-emergency ambulance transport. As Mr. Borak said, that's the one the state has to go in there and check whether all those equipment, are functional, because their client is basically the critical illness clients, the cancer, the heart disease, all the kinds of complication, diabetes. And diabetes, as I understand, and Mr. Villagomez here, former Secretary of CHC, and he understood this. Diabetes it affects all your body functions. So when you transfer diabetic patient to one point A to point B, this non-emergency transport staff, the EMT that are non-emergency, they're in charge in that area. So any second, as the former DPS, commissioner of the fire, you did a great job. Senator, you did a great job there. It's a difficult job, with the availability of fundings. It's very important that they are trained, certified annually, and most important thing, the accessing to there's 2 things: accessing to Medicare certification by the state, which is DFMS, is to, number 1, it increase the BGR, and we're having a problem with our funding budget now. And number 2, to run our government, and number 2, it annual licensing and certification brings money not only to the capital here, the DFMS as headquarters here and not far from here, but deputy commissioners down in Tinian and Rhoda. And I understand that under Section 106, there's a rulemaking in this public 18-73 And that rulemaking gives them authority, gives the DPS defense commissioner to amend, so they can certify annually and get those fundings for training. One of the sections here, it provides Senator Cruz and Senator Mendiola and from Rhoda and Tinian, it gives them the operation. So my recommendation is this amendment is to put the money inside whatever they certify in Tinian, that money stays in Tinian to pay for training, for staff development, and also to pay for operational things like paying for telephone and other things, and anything that it's a revolving thing annually. So and of course that's the main concern that Mr. Bora here and others, that he as a person in business of transporting critical illness patients, he wants to make sure that he will not be audited by the federal government, because the billers, the finance consultants, it's very critical. And Medicare is 65 years and older, so I'll be eligible in November 22nd, this year for Medicare, and I might probably need one of these services in the future. I don't know, but anyway, Senator, another thing I want to make critical thing for the senators here and the legal counsel, Mr. Chairman, is under Section 203 on page 6. 203, Section Article 2, Division of Emergency Services, page 6. Let me see if I got this correctly. I marked it here now, sorry. Page 7, sorry, 203, page 7, line 9 to 13. I'm kind of worried about this. Can you, Mr. Chairman, with honorable, I would like to request the legal counsel to look into this, whether this provision, Section 203, and under page 2 on the bill, Public Law 18-73, page, where's that? Right back here, down here, page 3, under line 24 down to 29. Under line 24 to 26, it says the deputy commissioner, resident deputy commissioner, shall be appointed by the mayor of Tinian and advice and consent of the municipal council members from the respective islands. This Section 103 and Section 2, the one I just mentioned, are in compliance with Constitution Amendment 25. Because at one time, one section say that the mayor of Tinian hires the deputy commissioner, as well as Rhoda, but on this other section here, hiring staff with the approval of DPS commissioner here. So that's, for me, I see that as a conflict, potential conflict in constitutional matter. I believe that the municipality of Tinian and Rhoda, deputy commissioner, they should not put approval, because they mentioned their budgetary constraint. So it gives the discretion for the deputy commissioner here to with this discretion to give budget to Tinian and Rhoda, and that's very critical, because the life and safety of every municipality, Tinian, Rhoda, and Saipan, must be treated equally, and budgetary constraint, is very important. Senator Cruz, I'm from Tinian, and I support this, putting all the money in Tinian operation for the DFMS deputy commissioner. Put all the money there and have the Amendment 25 certify that, because I believe that hiring in the staff down there is part of the Amendment 25, because in 1985 Constitutional Convention. And this, Mr. Senator Chairman, I just want to come back later on. I know they table it today. Thank you for tabling until Senator Magofanya comes in. But I will just put that aside. And definitely there's revenue here. And as a businessman for priority care and Tanoan and others that are coming in, they want to make sure that they're not in violation of federal law and regulations from the Center of Medicaid from, I think, Washington D.C. And that's for this testimony for Public Law House Bill 2352, Mr. Chairman and senators. As far as there's two issues that Mr. Villagomes here mentioned about that opioid. I truly support that bill. And as far as the 2352, I believe that we should extend that, look into it, and possibly extend to non-emergency training, because they'll be transporting patients that are certified for painkillers, opioid, and others. So in between those time, between A to B, the non-NMT, non-emergency medical transport, they should. I recommend that they should be think about it to have that training. And also for this House Bill 2334, the euthanasia, I want to share something that is very critical. We have dogs. I love dogs. I'm support of having this having pets and security reasons. And as a cancer patient, I have pets because it's my emotional and support. And I always hang around. We have several pets, my daughter and my son-in-law and others. So I've been doing it since I was young. But giving controlled, I just give you my experience. When I was in Hawaii many years ago, I briefly worked for the Senate majority in the state of legislature in Hawaii for almost more than 6 months. And I was assigned to the Committee on Human Services. And one bill came in front of the Senate in the state of Hawaii, and they want to certify psychologists to administer, mental illness drug control substance. And they opposed. The psychiatrist came and said, no, you're not going to give them that because we're medical doctors. We have to have control of this, have say-so approval. And the psychologists say we have to because we're out there professionally, but they're not certified to administer controlled substance. And in similarity with this House Bill 2334, I want these Senate members, Mr. Chairman, to table this and look it closely, because with only the Humane Society and this Ms. Cabrera's testimony, and we don't have a veterinarian here, a certified veterinarian, to come in and see what's the purpose. Because euthanasia is not only discussed in human, I mean in pets, but humans. I was there in Hawaii. I attended a couple of the hearing when they're talking about euthanasia for humans, and it's very controversial, very critical for humans. And this is no difference from this one. I know the mayor needs help, and I was shocked that Ms. Cabrera and others have done 1,000 pets, and for me, this has to the state, which is the semi government, has to step in and have more control about this controlled substance, especially euthanasia, and have more community involvement. Pet owners to come in and testify. Can they be a part of this to decide how they dispose these overpopulations of pets running around, dogs, the control? Can they do a program that this Senate, this House body, the Senate body here, provide fundings for more veterinary technicians and full-time veterinarian here, and the senior government? And it's important that they're trained to figure out how to in Chamorro they call it kapun, right? Castrate. How to so the overpopulation of these dogs would be slower down, but giving non-government to handle euthanasia more authority, I strongly oppose that. Because Mr. Senator, Mr. Chairman, it could be abuse. It can be abuse, and to do euthanasia, abuse. For dogs that are running around, and we can do more to programs to reduce the number of dogs running around, and of course to adopt. And for that, Mr. Chairman, I would, Jesus Masi, I would stop my testimony, and I'll wait for the next hearing for the this House Senate Bill 2352, and I would truly appreciate if Mr. Chairman, if the legal counsel staff from the Senate and even the House will look into the Amendment 25. Does it conflict with this House Bill? Public Law 18-73, and this is very important because that's the reason why they established the constitutional amendment, so they have more authority in hiring and appointing down in Tinian and Rhoda. Thank you very much, Senator Magofnian, Senator Cruz, and Senator Mendiola, and Senator Mr. Chairman. Thank you very much.
Thank you, Mr. Hofschneider. If there's no one else here to provide public comments, we will close that portion of the agenda and move to the next item, which is old business. And under old business, we have for discussion House Bill 2348 entitled to amend Title 4, Division 9 of the Commonwealth Code to place the apprenticeship program within the Department of Labor and to repeal 3 CMC Section 1351 through 1358 in their entirety and for other purposes. Discussion from the members? I think members, the last discussion we had in regards to this bill was, I think one of the proposed amendment is to provide for an increased time frame for finance to establish the regulation. Currently, this bill provides for rev and tax to come up with regs within 90 days. And the recommendation was to just provide them an additional, at least 6 months, so 180 days. If there are no objections, we'll just make that amendment to push it to 180 days. Additionally, some concerns were brought up in regards to allowing the apprenticeship program to be under the list of institutions that will be given ETC, and that while the apprenticeship program does provide educational opportunities, it's not technically an educational institution, but more of a program. And so one recommendation was to just scrap that portion of the bill that puts them under that lists them as an educational institution under the ETC. Any concerns in regards to that? They were here to testify. I do believe they did provide written comments. Yeah, they were. I think this was drafted maybe by them. Devin, do you have the copy of the comments? We can provide that to you, and then we'll take a recess after we discuss the rest of the bill, and then come back and further discuss that. While our LA is opening up the comments, and we'll share it with the members, we'll come back to this after the members had time to review those comments. And so at this time, we'll move on to the next item on the agenda, which is new business. And so before we act on any of the House bills, I would like to invite Mr. Borja back just to answer a question or two in regards to Senate Bill 2352. That way we can excuse Mr. Borja after we've had that discussion. Thank you, Mr. Borja. Just a few clarifying questions, if you can assist the committee with understanding just the current process of certification. And so I know you mentioned that being able to get the ambulatory vehicles certified. But just to understand how would, so currently, do you know how the process works with the certification of other ambulatory services in the CNMI? And if these other agencies are providing these services, how do they get their certification if they do have one?
Okay, so in the CNMI, there is no law that requires for ambulance to be certified. And however, with Medicare and also Medicaid is also following Medicare's regulation, is that if there's no state law that does not, provide certification, my understanding with Medicare is that they will still need a state agency to either write a letter, and it has to be a state, stating that the company can operate. Now, that's, for me, according to my consultant, my biller that I've been working with for 10 years, and they're very close, understanding Medicare rules and regulation. It seems like every year, Medicare is very stringent. They tighten up the rules and regulations. And a lot of these is because of fraud cases or, non-compliance and, not just the ambulance company, but medical facilities especially. And one of the regulation is if they come back and maybe 3-4 years from now and say, who is certifying your ambulance, and we don't have that documentation, then they can actually take us to court, and we need to justify where and how and provide that certification. In Guam, with Department of Public Health EMS services, what they do is so whenever there's an EMT class, for example, a GCC, and they completed their class, they go to the EMS office, and EMS office issues the EMT certification, the state EMT certification that they completed, and then they're certified. Excuse me. On top of that, they also do the certificates for ambulance, and they're the one also that issues that. And what they do is we call them up, and when we call them up, we make a schedule, or we go to their office, and an agent or one of the staff will come down, and we'll go through the list. This list of durable medical equipment and durable medical supplies is the one that I mentioned earlier, our standard list, that the basic list what the US are using it, and what the fire department should have, and that's just a standard. So they go through that list. For durable medical supplies, there's about maybe, as far as when I count the inventory, there's maybe like 75 items. And then durable medical equipment, there's about 40 lists. If you have all of these lists, and once you have all of that list, it even goes to as far as the size of gauze, from 2x2 to 4x4 to 4x9. It's all listed there. So we have that inventory. Once you complete that list, they will certify you and issue it. And it's a yearly certification. It expires every year. That particular list and that certification, we attach that, and we have to update Medicare also yearly, even with our business license, our EMT certifications, and our ambulance certifications. So it's a yearly. When that thing, what Medicare are looking for, they just want to make sure that the ambulance company that are transporting Medicare patients, that this ambulance have all the equipment and that are certified and that they're on compliance with what what on the list of that, what the sort of what they need to have inside the ambulance. It is very important to have all of those in there, because even as a non-emergency dialysis patient, and we do encounter this from my past experience, they code. Sometimes they didn't drink their medicine, or they didn't eat, they didn't have enough food, or less sugar, or worse sugar, the sugar goes up. They code. And so the equipment that we have inside, we have oxygen, we have AED. We don't have any medication in there. We're not allowed. Well, the only thing that I can administer is oxygen and AED, and of course checking their glucose. We have a glucose meter in there. And also on top of that, if there's an emergency, we are required to call 911, which is the DFEMS. And from there, we'll communicate over the phone. The EMT will communicate over the phone, and they will meet them halfway. As soon as they meet halfway, they'll get as close to the hospital to get them there. As soon as then they turn them over to DFEMS. Then DFEMS will receive the patient and will take him into the ER. My understanding is basic life support ambulance company are not allowed to do ALS, which is the advanced life support. So the way that we work, the way in Guam, the way they work, or the way it was done, is the transfer of care from BLS to ALS. So that's what's happening, and that's how it, on my past experience, I've been doing this I've helped 3 companies, and plus my company now, so this is the 4th company, and I've been doing this for the past 20 years, 25 years, and those are the things that I encounter during my experiences. Most of my experiences are actually in Guam. So finally, in 2022, I decided to open this company, and I wanted to move back to Saipan. I've been there for 15 years, and I decided I want to come back to Saipan. I want to provide these services for our my patients. Medicare will pay for it. Medicaid will take care of it. Other insurance, even veterans will actually they pay for non-emergency, certain insurance, but definitely Medicare and Medicaid. What I wanted to do is bring these services back to Saipan, provide the highest quality basic life support services that we can provide for our community. And I wanted to really, I'll be honest with you guys, I wanted to be the world-class business license, basic life support, non-emergency medical transporter in Saipan to provide, because we need to utilize the services. We have, most of us, including all of us in here, by the time we're 65, we're Medicare subscribers. We're automatically in Guam. I encountered Manomku that they don't have Medicare, and I found out that that's because they didn't subscribe. But in the cinema, I won't be surprised. I don't have any statistic, but even all of us in here, including all the people that are working right now, in 10 years, they will have Medicare, and we need to avail that services. So as far as that, that's definitely, want to utilize that, and we need, want to make sure that we utilize the benefits of the Medicare. But going back to the certification, basically, if we have a certification agency that certifies, we can continue to provide services, and we don't have to worry about Medicare coming back and just asking us questions or auditing us, and that and then we don't have the documentation in place. They're very strict. They're very stringent. They're gonna get more strict as years progress. I remember we used to provide medical records for patients like once every 3 years. Now they require us. We need to have updated medical records, the status of the patient, the reason for transport yearly. The PCS, which is the physician certification statement, it expires every 90 days. So we need to have all of those. So this is just one of the certification, but this piece of a certification for ambulance is very important, because that's the one that, we pick them up door to door from the house and to the hospital, And thank God the Saipan's perimeter is not as big as Guam, but it's just that moment there that from the resident's house to the dialysis center, anything can happen, just as the same thing as from the dialysis back to the resident. Our perimeter has about, I calculate about 9.5 is the longest in one way from Cacman to the hospital, or maybe even less than that. So we're okay here. In Guam, we're talking about 25 to 30 miles distance, from down south to up north. So even with that, the certification is still important to make sure that we have all the equipment in there. So in case of emergency, all of our equipment is in place, and that we make sure that we make sure that we get this patient to the hospital as soon as possible. So 22-52, not only that, it will continue to build the quality of life of our community, especially the vulnerable bedridden patients, the dialysis. And as you may know, our dialysis rate here in the Sinai per capita is pretty high. I don't really have the statistic on that, but I can get that information. However, it is high for our community. So I'm here to provide such services, and hopefully, my goal also is to build the quality of life of, or help lengthen the quality of life of people here. And that's one of the reasons why Medicare pays for the services for ambulance non-emergency, is to enhance the quality of life of the people, of the Medicare recipients, and also to make sure that for recovery, where they provide these services, and people actually died, patient actually from bedridden to non-bedridden, they actually recovered. And I encountered that. I actually transported a bedridden patient, dialysis patient, for 3 months, and after that, she was able to get on a wheelchair, and I had to discontinue because she was well. So that's the reason why Medicare also provides this. However, they do have a very stringent regulation, and one of them is the reason for transport. We got all that in place. We have a system called EMS Zoe that we report our patient care report. We have a biller that works directly with Medicare. So we got all that in place. The only one that I'm missing is just this certification for ambulance, and that's very important. Car inspection, insurance is there. They even have the DQ. I just found out that they do emission control. You have to get that thing done. I got that thing done. Now, the only thing that I wanted to just make sure that I'm certified is that my equipment, that the list that I have, and even DFEMs have those lists, and I can even provide them if they don't, if mine is a little bit, I'm not sure if it's, they might have spine board with straps. If they only have spine board and no straps, or that's what I got, it might be a little bit different, but not too much. But it's usually the same standard, U.S. and Guam. So Guam Fire Department, actually, I followed the Guam Fire Department DME and DMS inventory. So that's what I use. And as a matter of fact, my ambulance now that I have is certified in Guam, and I do have that certification. However, it's no longer, I can't use that here, but Medicare will not allow me to use that. I have to use the state. But my ambulance is certified, and I'm looking forward to, have my ambulance certified here in Sinai, so I can, when I report everything to Medicare, because they want us to make sure that wherever you're at, whatever state you're at, everything has to come from within that state, as far as their, certification. So that's basically all I'm missing right now. And as much as I can, I want to operate, I do want to do that. But at this point, because Medicare is going to be one of the primary payers, because they're, and they'll be the one to come back and ask me, maybe in 2 years later, they'll come back and do an audit themselves, where they just randomly come in, and they'll pick up any folder, and they'll say, okay, I want to see this, the case on this, what is the reason for transport, and all your certification of your ambulance, your EMT, and your documentation. So that's all it is. And it is an indefinite service, which means that we can actually continue this as long as, the services, the management goes well. And one of them is the certification process. And we do need, definitely the certification process is a yearly thing. So it's not one-time certification. Every year we have to certify. It's just like a nurse. The nurse has to, or or in the medical field, you can be a nurse practitioner, but they have a certification. And then if you're retired and you're no longer, you can still be a nurse and you can still get a nurse. But as an EMT, as long as you're EMT, or as long as you're providing ambulance services, as long as you're providing, you need to get certified. And you don't have that certification where it's a license for 5 years or 6 years. It's a yearly thing. So we need to constantly certify our equipment, our staff, our documentations, and yeah, basically those are the three main things that, in order for me to properly run and make sure that, I'm not, there's no missing, documents. Documents has to be in order, basically.
Yeah. Thank you for that explanation, Mr. Bora. But I guess so. My main question is, you mentioned that in order for an agency that provides ambulatory services to be, I guess, paid by Medicaid, there needs to be a justification from the state. And so, how would an existing agency that does provide these services get that justification without having to get the certification from DFMS or?
I'll be honest with you, Senator. I have no idea. All I know is what I understand in this kind of operation, and been doing this for the past, like I said, 20, 25 years. And in order for me to continue to do this, I know that this is one legislation, or this 22-52 will, but as far as the other company and how they're doing it, I'll be honest with you, I have no idea how they're doing it. But I know that if I were to get into this, I want to follow, how I've been doing it back in Guam, and also according to my biller, which is also my consultant when it comes to medical regulation, guiding me forward on this, on these, about this 22-52, and how important it is. But again, I don't know.
Okay. All right. Maybe that's something the committee can look into further. Before we excuse you, Mr. Bora, I'd like to recognize Senator Mendiola for his question.
Actually, thank you, Chair. He just answered the question. So I was just trying to get to the bottom of if you understood if other agencies are being regulated as you're requesting to have your equipment certified. So I was just kind of trying to get to the bottom of whether they are regulating other agencies.
Senator, I don't know. I have no idea how their operation, but just to one of that I will mention again, and if I mentioned it earlier, just let it be known that, as you know, St. Michael back in 2012 have a case, and they were reported that they were transporting without a certification, and apparently they got shut down. Don't know really it's a public, it's in the website of that case. You can Google that and it shows there, and it even entails everybody's, who, from all the process. But
You're not sure?
I'm not sure.
Okay.
But
Thank you.
I don't want, that's just the way I feel. But with
Thank
this
you.
country, okay. Thank you, sir.
So with that, Mr. Chair, and this is pretty much the reason why I'm trying to move, so that we can table this and bring in the chair and kind of iron out some of this. Maybe bring in DFM so they can answer some of the questions if they're ready to regulate this, or if they're ready to certify an agency. What are the liabilities? And I'm further looking at, there should be charges, because now we're looking at government man hours to go out and certify equipment. So what are the charges? What are the intended or proposed charges for this? So
Yeah.
Thank you, Mr. Chair. Yo.
Thank you, Senator Mendiola. Thank you, Mr. Borja, for shedding light on some of the concerns that were brought up and providing us with a better understanding of the need for this certification program. Like what Senator Mendiola had mentioned, I think this bill is something that would need further clarification in terms of the cost it would take to administer the program and what those reasonable fees would be to assess in order for the program to be able to be self-sustainable as well as um, uh, provide those services to all the entities that provide non-medical transport. And so as we wait for the author of the bill to come back and to address some of the concerns that aren't addressed in the current bill, we'll schedule a follow-up committee meeting to possibly call in the other entities that are affected by this legislation to address some of the concerns by the members. And so thank you for your time here today, Mr. Borja. And we'll reach out when this bill will come up in our next committee meeting. And sorry, before you leave, I think Senator Mendiola had something he wanted to say.
Just one more clarifying question. You said you established already your business and you're just spending this? I mean, you've opened up a business license, or you got a business license and all of that, right?
Yes, Senator. I actually established this in 2022,
2022.
and I actually started renting an office since 2022. And 2023, I finalized the business license. We're an LLC company. Got 2 ambulance already on board. We're fully equipped. We got the staff, we got the billers. We're ready to operate. The only thing missing is just our application to Medicare, and one of the missing document is just that certification.
Okay.
But
Okay, and the reason why I asked that question is because to establish its urgency, since you've already established an office and you're opened up a business license, right, or got a business already situated. So I think it's just important to illustrate that so that we can try and push this and try and bring in the other agencies, clarify all these misunderstandings or clarify all the gaps, and then we can push forward and push this to the committee of the whole. Thank you, Mr. Chair.
donc le susmasi, I'm paying my taxes already, so I've been contributing already, because I do have a couple employees that will get on board to get it going. So I've already been making some, I've been actually on my operation expense. I'm just ready to go now to do my job and, help our community. So thank you so much.
Thank you, Mr. Borja, for your time today. Again, we'll reach out once we mark this up at our next committee meeting. Thank you.
Thank you again. Susmasi.
Members, so at this time, if there are no objections, we will table Senate Bill 2352.
None.
All right, now moving on to House Bill 2323, entitled to establish a Cinemite drug overdose policy to authorize and mandate first responders to possess opioid overdose reversal medication, to authorize standing orders for opioid overdose reversal medication, to provide limited immunity for dispensing opioid overdose reversal medication, and for other purposes. Any discussion on the bill, members? I think that the House has done a tremendous job in providing for a committee meeting that reached out to these entities, as well as these entities providing their comments to the Senate. I do not have any concerns regarding further amendments, unless if I can ask Mr. Villagomez, based on the version that the House has passed, are there any additional concerns you may have in regards to any of the language that was passed? No objections. Okay. Thank you. Members, any discussion? Can I get a motion on the adoption of?
So move, Mr. Chair.
All right, there was a motion made to adopt House Bill 2323, and it has been seconded. All in favor, say aye. All opposed, say nay. Motion carries. House Bill 2323 is hereby adopted. Next up is House Bill 2334, entitled "To Establish and Authorize the Use of Legend Drugs and Controlled Substances for Euthanasia by Animal Control Agencies and Humane Societies." Discussion on the bill, members. One second, members. Just a brief question to Ms. Cabrera. Just a concern regarding one of the section, require that any individual administering sodium pentobarbital or legend drugs has completed legend drug and euthanasia training under the direct supervision of a veterinarian licensed in the United States. That portion, and so how would this individual need some kind of certificate proving that they've been that they've undergone training, and that or does this mean that any person who claims to have gone through training could administer this drug, provided there's a licensed veterinarian that oversees that individual? Sorry,
Thanks. In order to obtain the drugs, you need a DEA license. So this bill would allow, like, the dog shelter to have a DEA license so they can order the drugs from a veterinary medical distributor. Because they are controlled drugs, I have a DEA license as a nurse practitioner. There's a lot that goes into handling these drugs as far as documentation, ensuring they're stored properly. There's a lot of federal regulations surrounding that, but euthanizing animals is nothing new in the country. And so there's pretty well established training programs that are like standardized and rolled out across the country. The training, the challenge with it being conducted by a licensed veterinarian is that there is none here. So we could either bring a veterinarian from Guam who also does the training for the shelter there, where I'm involved, or we could adjust the wording of the bill to have a veterinarian or somebody trained by a veterinarian in this to administer the training. The main focus is that the training provided ensures that euthanasia is provided correctly, humanely, safely for the animal, safely for the people handling the animal, and within federal regulations of handling the drugs.
Okay. Does currently there's a practice work where someone such as yourself or someone from the Humane Society can administer the drug through a veterinarian who oversees them through like a video conferencing, in the sense that it's treated as telehealth in the animal field? I'm not too
Yeah.
familiar. Is that something that is possible, that somebody can oversee through telehealth?
Like
if,
the training, I think,
the
or
administering
in
of
gen-
the drug, I guess.
Okay. So that actually ties into the other bill that we are working on, which is to allow people, veterinary technicians and mid-level providers to practice under they call it indirect supervision. It's having a relationship with a veterinarian that oversees them, but they're not here. There has been some confusion. I've tried very hard, because I have a DEA license, and my supervising veterinarian has one. So I've talked to the DEA a lot, trying to figure out if I'm able to dispense these drugs. But I have not gotten a concrete answer from them. So without like having a firm answer from the DEA regarding that, we were hesitant to proceed with using the controlled substances to euthanize animals in that manner. It would just be a lot like cleaner and more straightforward to have a law for it.
Yeah. I guess just one more clarifying question. So I know you mentioned that you are licensed to get to get these drugs, but I guess the term required that any individual administering the drug, even somebody who may not have any sort of medical license or medical training, someone who's an intern, for example, I guess that may be a problem in the sense that we're just giving anyone who goes through this training. I'm not sure how long this training would take to provide to be able to administer the drug, but is that something that you think should be clarified, and that it's more it's clear that this should only apply to those with some sort of training in this field?
So that's a good question also. The thing about animal shelters in general is that a lot of the people providing euthanasia do not have a medical background. You would be very hard pressed to find a veterinarian who would be willing to go euthanize dogs for a shelter. It's just below their skill level and training. And a lot of veterinary technicians also, they'll be working at the vet hospitals trying to save animals, not trying to euthanize them so much. So it's actually very common, like the animal shelter on Guam, we have staff who are kennel assistants, and then we have some of those who've gone through the training and they're certified euthanasia technicians, and that's what it's called. And the DEA recognizes euthanasia technicians and shelters that hold a DEA license. It just depends on the state's wording of their laws regarding euthanasia. So I would be okay. Like personally, I euthanize the dogs with the dog control staff, and there's a few of them who I've trained, and they're very, very good at it. I think restricting it to medical personnel would be challenging because we just don't have that here. So yeah.
Thank you. Any questions? Senator Mendiola, recognize.
Thank you, Chair. I just have one question. And obtaining a federal permit for, I guess, accessing these drugs, is there, in that permit, is there like requirements for storage, the way this drug is stored or whatnot?
Yeah, there are federal regulations in how the drug is stored. It's supposed to be in like a safe that has 2 locks and it's screwed into the floor. And it's standardized across all agencies that might hold controlled drugs, so the hospital and all those things. So those are covered in the euthanasia training program, which is standardized through like the Humane Society of the U.S. and the American Veterinary Medical Association.
Thank you. And I asked that just because there's nothing about storage, safety. But if the federal level in obtaining this permit has that regulation, then I don't think we need to have that in here. So
yeah, originally I had written like a much longer bill that went into all that, and then I think it was just like too much
repetitive. Yeah. Thank you, Chair.
Thank you. Any other members? All right. If there's no other concerns, thank you for your time today, Ms. Cabrera.
Thank you.
And for answering questions by the members. All right. Further discussion from the members? Any?
I know that the mayor submitted a supporting letter for this bill. But in regards to the additional, I understand Mr. Absenado mentioned earlier about the additional responsibility. I hope this does not burden the municipality with additional cost on any matter pertaining to this that is not budgeted through his cinema budget to fund this or any that might any cost that might affect the mayor's responsibility. That's only concern that because I know that if it needs additional funding, it's going to come to the local delegation. And my concern is I don't know how we're going to. Thank you, Mr. Chairman.
Thank you. I think this may be more. This probably could be considered cost saving in the sense that it may be, in order to address the problem of stray dogs. Whatever the case may be, it may be more costly to continue to feed and care for these dogs as opposed to. But then this basically just authorizes an entity to be able to obtain or to administer the controlled drugs, and so yeah, if the mayors can't afford it, then we can get the assistance of the Humane Society. Any other questions or concerns? Can I get a motion for any action on the
So
bill?
move, Mr. Chair.
Can you clarify your motion, whether it's to adopt or table or?
I'm offering a motion to adopt House Bill 2334.
34. All right, there was a motion made and seconded. All in favor of adopting House Bill 2334, say aye. All opposed, say nay. Motion carries. House Bill 2334 is hereby adopted. Next up is House Bill 2387 HS1, entitled to amend 3 CMC Section 2824 to authorize the Commonwealth Healthcare Corporation to organize and assist in establishing a charitable foundation. Comments or concerns from the members? For discussion, if none, can I get a motion for any action on this bill?
Mr. Chairman, is this 52 or 53?
80. No, we're in House Bill 2387.
Thank you, Mr. Chairman. I move to adopt House Bill 2387, House HS1.
Second.
All right, there was a motion made to adopt House Bill 2387 HS1 and has been seconded. All those in favor say aye.
Aye.
All opposed say nay. Motion carries. House Bill 2387 HS1 is hereby adopted. As discussed, Senate Bill 2352. Sorry, my apologies. It hasn't been discussed, but more of just meeting with the entities. Members, any action? Can I get a motion for any action on this bill?
This is 2352.
Yes.
Mr. Chair. I offer a motion to table this House Bill 2352. So move.
All right, motion was made to table Senate Bill 2352 and has been seconded. All in favor say aye. All opposed say nay. Senate Bill 2352 is hereby tabled. That addresses all the bills under new business. Now, going back to old business, House Bill 2348. I know Senator Cruz had requested a copy of the comments by Labor. And so at this time, we'll take a 5-minute recess for the members to review those comments, and then we'll go back to discussion on that bill. 5-minute recess. to our committee meeting, and prior to going on recess, we are discussing House Bill 2348. Members, at this time, I'd like to propose that we substitute this version with the version provided by the Department of Labor in consultation with Rev and Tax. So basically, the new version, the proposed version is that we substitute all terms with deduction to tax credit as opposed to deduction. I also propose that we remove the education tax credit section of the bill and include in the replace that section 5, the tax credit, with the actual repealer, which is mentioned in the title. It's to repeal 3 CMC section 1351 through 1358. The bill doesn't include the repealer, and so we'll just replace section 5 with that repealer for those sections. And so a substitute will be made available to the members with the committee report for further review. Any additional changes could be made on the floor. And so at this time, I'd like to move that we adopt the substitute consistent with the comments provided by Rev. Tax and Department of Labor.
So move, Mr. Chair.
Second. All right. There was a motion made and seconded. All in favor, say aye. All opposed, say nay. House Bill 2348 SS1 is hereby adopted. All right, members, we now move down to item 6, miscellaneous. Any announcements or miscellaneous from the members? If none, just to recap, Senate Bill 2352 will be discussed at our next meeting after we receive additional comments and we're able to address some of the concerns to the author of the bill, as well as to invite other entities to testify in regards to this bill. All right. If there's nothing else from the members at this time, can I get a motion for adjournment? All right, motion was made and seconded. All in favor, say aye. All opposed, say nay. Motion carries. This meeting is hereby adjourned at 11:51 a.m.